Dr. Stacy Summers was a PhD student at Colorado State University, where I worked previously, and she did her whole PhD in this area, and we've collaborated quite a bit here, looking at the concept of dysbiosis and the production of uremic toxins in cats with kidney disease. And what we know, based on her work and her PhD project, is that we do have dysbiosis in cats with kidney disease. And what does that mean? Well, again, it means that the bacterial population that you have in your gut, the microbial community, it's actually decreased in diversity and it's decreased in richness. And that may then, again, be related to having more bacteria that would produce these uremic toxins. So that dysbiosis is the first piece. You've got that's going wrong in the gut, and dysbiosis happens for a number of reasons in chronic kidney disease. And then the second piece of that is we have demonstrated, and not just us, in several other studies, that cats with chronic kidney disease do have increased uremic toxins, and in particular, that Indoxyl-sulfate one that I mentioned previously. So what does that look like? Well, this is what our data looked like. We had normal control cats who were a little bit older to try to match the age group of the chronic kidney disease cats. And we looked at IRIS stage 2 and IRIS stage 3 and 4 cats. And not surprisingly, when you look at the human and the rodent literature, there are more uremic toxins building up in the blood of cats with both stage 2 and stage 3 and 4 kidney disease. And what was kind of surprising to me was even those pretty early stage 2 cats, they do still have uremic toxins that are building up. And you can see this graph kind of goes up over time. The problem gets worse and worse as your kidney function decreases. So that makes perfect sense when we're talking about trying to eliminate something through the kidney. As your kidney disease gets worse, in fact, the elimination is more challenging. And we're not the only research team to have found this information. So there was also another study that looked at both cats and dogs with kidney disease. And here in this study, they found something very similar. Indoxyl-sulfate serum concentrations were correlated with creatinine. And again, in this study, stage 2 cats definitely had increased concentrations. So for me, I think before seeing this research, we assumed maybe this was something that was only happening in the later stages of disease. And I do think this means that we have to give cats in stage 2 kidney disease a little bit more credit for having toxins building up in their bloodstream. You know, that feeding into their problems with appetite and their weight loss, and that even though they're more clinically stable, they probably are starting to struggle with these things, and we should think about them needing help in this arena as well. So it's not uncommon for me to be seeing cats in stage 2 kidney disease who are losing weight, may have appetite problems, and we do think that uremic toxins feed into, you know, affecting appetite centrally in the brain. So that's another area to be concerned. There's another big area to be concerned, though, when we're talking about actual progression of disease. And so there was another study here that showed that cats who progressed in their kidney disease actually had higher Indoxyl-sulfate concentrations. Now, to be fair, this is not a causation study. We can't say for sure this is the case, but it is concerning when you see this difference, and that might be a marker that would be related to the possibility of progression. So it's just more information for us on the feline side to say we probably should be concerned about this and looking at it a little bit more seriously.